In this video, we will show the setup and demonstrate the use of the Umbiflow device. All examinations were done by Dr. Tsakani Tlongwane and Dr. Valerie Van Hevel, both obstetricians and researchers at the UP SAMRC Maternal and Infant Healthcare Strategies Unit. All three pregnant women in the video were asked and agreed voluntarily to participate in the recording and consented to the video being used for conference purposes. All three women attend antenatal care at Kalafong Provincial Tertiary Hospital in Pretoria, South Africa. All measures to prevent the spread of COVID-19 were adhered to during the recording of the video. The woman will be on an examination bed in a wedged supine position. On the table, a Windows-operated laptop has been set up and the Umbiflow device is connected with a USB cable. We use ultrasound gel and an invoice printer is connected to print the result. Before the start of the procedure, the doctor explains the examination to the woman. The doctor will start by palpating the abdomen for the fetal lie and will measure the symphysis fundal height. Palpation of the abdomen is important to examine the fetal lie and the position of the fetal spine. Next, the woman's details are being entered into the Umbiflow software on the computer. She starts by entering the folder ID or hospital number, followed by the first name and surname of the woman, here replaced by letters. She then enters the date of birth and the software automatically calculates the woman's age. She then enters the estimated due date of the woman and the gestational age will automatically be calculated. After that, she indicates how the estimated due date was calculated and she enters the symphysis fundal height. Now we are ready for the examination. The doctor applies gel to the abdomen of the woman and starts the examination. Palpation of the abdomen, as shown before, is important to examine the fetal lie and the position of the fetal spine. Ideally, one starts examining the abdomen with the Umbiflow device on the opposite side of the fetal spine, where one would expect the fetal umbilical cord to be. The device is moved on the abdomen until the doctor hears a good audible umbilical artery signal and sees a good quality waveform on the screen. Keep in mind, this is a Doppler device without the fetal imaging as in conventional ultrasound, so it can take a few minutes before a good quality waveform is obtained. Here, we are seeing good quality waves with equal amplitudes for both systolic and diastolic flow velocities. After freezing the image, the resistance indices of the umbilical artery, including the RI, PI, and SD ratio, as well as the fetal heart rate, appear in the right upper corner of the screen. This was the audible fetal umbilical artery signal. The software then automatically plots the RI against the gestational age of the woman, and this graph is shown to the woman. This woman's RI of 0.73 is just above the 75th centile for her gestational age of 28 weeks. The woman is known to our high-risk clinic at the hospital with a poor obstetric history and was seen on the same day before the video recording. On ultrasound, her RI obtained via pulsed wave Doppler was 0.74, which proves a good correlation between Umbiflow and pulsed wave Doppler. Afterwards, the doctor saves the result on the computer so it can be reopened at a later stage. The next participant is 32 weeks pregnant and is also known to our clinic with hypertension, a poor obstetric history, and high Doppler values. The RI obtained via Umbiflow in her case is 0.84 and above the 95th centile for her gestational age. On ultrasound, she was found to have intermittent absent end diastolic flow and she was admitted to the hospital for fetal observation. This was her audible waveform. Her result is printed on the invoice printer. printout shows the obtained resistance indices, the Umbiflow waves, the graph, and the classification according to the centiles. The next woman is 30 weeks pregnant and has no known antenatal risk factors. The RI obtained via Umbiflow is 0.68 and is below the 75th centile for the gestational age. Her result is subsequently printed, and again, the printout shows the obtained resistance indices, the Umbiflow waveform, and the classification below the 75th centile.